2 inches and you feel really light.
Good. Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now, you've traveled quite some ways to get here. You're from?
California.
Okay, so she just came from California out here. I'd say probably the furthest in-state that I've had. I've had, a couple from out of country, so those were a little bit further, but definitely cool to see people coming from, across America to come here. Now, as I was reading over the paperwork, headaches.
Yes.
And the main issue is hips and low back, though, correct?
Yes.
Okay.
Specifically the right side.
Okay, so right-sided now. Is that anything that you did to, like an injury, or has that just been kind of gradually coming from over time?
I'm pretty sure it was an injury from when I attempted yoga.
Okay, when you attempted yoga.
When I attempted yoga, it's because I don't know if it's like piriformis or sciatic, because I did something, and then when I lay face down or sometimes face up, it sends like a shooting, numbing pain.
Okay, and it's only down the right side? Okay, how far down does that go?
Probably to mid-thigh.
Okay, so it's coming, okay, it doesn't cross the knee, go down, okay, so into mid-thigh. Alright, so what we're going to do today, we're going to go through ranges of motion, we're going to do the orthopedic test. Kind of want to get a baseline, just see where you're at today.
Okay.
Have you had chiropractic here before?
Yes, I have.
You have? Okay.
Yes, I have I guess like a membership.
Okay.
With somewhere in California.
Gotcha.
I really like getting my back cracked.
Good. Alright, so this may be a little bit different.
Okay.
Especially with the Y-strap adjustment as well. Have you had any type of decompression adjustment before?
I have. They don't do it very often.
Okay.
And it's usually manual, like just with his hand.
Yep, that's actually the first way I learned it was with my hand, so definitely a good technique there. Alright, let's start off. I want you to look all the way up and all the way down. Any pain when doing that?
Nope.
Good. Bring your ear to either side. Any issues with that?
Just tight.
Tight?
Yeah.
Okay. And then if you were to rotate over either side. Any issues there? No? Okay, good. Alright, I'm going to have you stand up, and then if you were to bend forward at the waist, any pain when doing that?
No.
Good. When you extend back like this, any pain with that?
Yeah, it's starting to
Okay, so you notice it when you go
Yeah.
more towards that end range, you start to feel it. Okay, and it's just on the right side? So going from like here.
It's like from right here.
It's like from right there. Okay, so she is pointing more towards piriformis. So I'll do a couple muscle checks and we'll see if it's a little bit more piriformis, or it could even be sacral.
Okay.
So a lot of times it can be the sacrum that's causing that. So I'm going to have you come down to one side. Any issues there?
No.
To the other side?
No.
Good. And then if you're to rotate, any pain with that?
No.
Or the other side?
No.
Okay, good. I'm going to have you first lay on your back for me. Yep. So I'm going to raise this leg all the way up. Let me know if you have any pain in the hips and the low back.
No.
No.
Tension.
Just tension? Okay, if I bring that foot forward, any pain or tenderness with that? Granted, you might have like tight calves, tight hamstrings, so that is a normal, but...
Yeah. I think it's just tight calves.
Okay. Bend the knee, cross over. So we're going to bring that down. Any pain in the hips or the low back with that?
More in the groin, probably because it's tight. But that usually helps with this pain.
Okay.
Like if I do a pigeon stretch.
Gotcha. We're going to raise this leg up. Any pain in the hips or the low back with that? Good. We're going to flex that foot. Any issues with that? Good. Bend that knee. Cross over. Any pain with that? Good. Alright, I want you to flip over on your stomach for me. Okay. So I'm going to bend this knee. Any pain in the low back or the hips?
Well, yeah, I think I feel it here.
You feel it over there? Okay, if I bring this leg in, any pain like that? If I bring this leg out, any pain? Good. So we're going to do the same thing here. Where do you feel pain? Okay. Is it painful pushing in right there?
I don't know if it's conditioning, but it actually feels good.
It feels good?
Yeah.
Okay.
Like it's relief.
Okay, so she's feeling a relief when pushing in on the piriformis like that. So we're going to bring that leg in. Any issues with that?
Right here.
Right there? Okay. And then when we bring that out, any issues with that? Okay, good. Alright, so that you are laying face down here. I'm going to have you put your arms, right there for me. Alright, that she's laying face down, what we're going to do, we're going to start off by scanning the entire body. What I look for, I compare that right side to the left side. I'm looking for symmetry in the body. Just bring her hood up there for a second. So I'm going to do some palpation. I'm going to push into your spine. Let me know if anything is tender to the touch. And then, yeah, so I'm just going to be looking for any tight, tender muscles, any bony abnormalities, and just be scanning that entire body. Okay.
When you first push.
When I first push, more on that right side? Okay. So a little bit of pain in that right side of the neck. So now from that cervical spine, we're going into the thoracic. Any pain through this? Good. From the thoracic spine, now we're getting into that low back, into the lumbar vertebra.
That's a little tender.
That's a little tender. So the upper lumbar, L1, L2, are a little bit tender for her. Okay. Any pain over the right SI joint? Any pain over the sacrum? Good. Any pain over the left SI joint? Good. So we're going to come down here and we're going to check on her leg length. So we're going to make sure, push those boots in nice and tight, but as you can tell, that right leg is pulling short here. So that's something that we're going to focus on when we scan up the body. So one thing that's good, hips are looking balanced. Just a little bit raised on the right side in the rib area, right that mid back. That's the only thing that I'm really seeing. So definitely looking quite symmetrical, which is a good thing. What we're going to do, because I did notice some tight muscles, we're going to use the Hypervolt, the massage device. We're going to start up in the neck, in the shoulders, following the trap, and then also because you were feeling relief when I was pushing in on the piriformis, I'm also going to do that on the piriformis. Okay?
Okay.
Okay, so you're having issues right in there. So we'll work on the piriformis as well. So we're going to start the adjustment up top in that cervical thoracic junction here. Okay. There we go. We're going to drop down to T3 here on the right. Good. Yeah, I like doing that right in the beginning. That just opens up takes like all the pressure off the nerves in that cervical thoracic junction here. Okay, so I'm gonna have you take a deep breath in and exhale out. Good. One more time, deep breath in and out. Good. Okay. So from doing the adjustments in that cervical thoracic area and that upper back and that middle back, I like to always come back after, check the leg length. So we're gonna push in, already better, which is a good thing. Still a tiny bit short here, but definitely better. So what we're gonna do, I'm gonna stabilize on your sacrum. I want you to raise this right leg up as high as you can for me. As high as you can, as high as you can. Any pain, tenderness, tightness with that?
Tightness.
Okay, relax that side. Where's this side for me? Any pain, tenderness, tightness with that? Alright, so this one was a little bit tight on here. Okay, what I'm going to have you do, I want you to cross your right leg over your left leg for me. Good. And actually, I'm going to have you slide down on the table just a little bit. Perfect right there. Okay. And the table's going to come up from below. There we go. And so what we're doing is that sacrum is a little bit rotated towards that left side. That's why the left side was easier to raise up. So what we're going to do, we're going to do a P to A, or a posterior to anterior drop on the sacrum, and we're going to torque that sacrum to bring it back to the midline here. So we want to bring it back to that right side over here. Good. Uncross. Bend just this knee for me. Good. And one more. There we go. And relax. Good. So from here, we're going to stabilize again. Raise that leg up for me. Do you notice the difference?
Easier to raise.
It's easier to raise. Good. That's exactly what I'm looking for. So we're going to come back down to here as we push in. Perfect. That is one thing that I like to see here, which is a good thing. Okay. So now I just want to go in, because I know you felt pain when I did push in through here. How does that feel through the lumbar spine? Do you notice that pain?
Right there now.
Okay. More on the left or more on the right?
The left.
More on the left. Alright, what I want you to do, I want you to lay on your side and face me this way. I'm going to bend that knee. Just going to roll you just a little bit. Good. Alrighty, moving. There it was. Flip to the other side for me. There we go. There it was. Lay flat on your back. Okay. So from here, what I'm going to do is a leg pull. With the leg pull, you'll feel release in the ankle, the knees, going to the hips, okay? You felt how that just released in there? Good. Perfect. I will have you stand on up. And I'll have you face my wife that way. Come a little bit forward. Perfect right there. Bring your arms out by your side. And I want you to put your hands up and over mine. Yep. So like this, I'm going to lean you back, squeeze your elbows together. Good. Okay, so that was pretty cleared out. I'm going to have you take a seat right here and face the wall that way. Okay. Alright, so I always like I first do that prone thoracic adjustment Then I do the standing intercostal, and now I like to do the supine or the anterior thoracic adjustment as well. So it does take a deep breath in and exhale out. There we go. Okay, so now that you are laying down just like that, we're going to do the Y-strap technique. Nope, so I'll have you keep your knees bent off.
Okay.
Perfect, just like that. Now, you had like a pull-through technique done before, but you've never had the Y-strap, okay? So, I want you to describe after how this feels, okay?
Okay.
Good. Okay. And then from here, I'd stand up at the top of the table here.
Oh, whoa.
Perfect, and just relax.
Oh,
How did that feel?
it released a lot of tension.
Now, was that a little bit different than?
It was quicker.
It was quicker, okay.
Yeah.
How would you describe the Y-strap to people who have never had that done before?
Like you suddenly grew 2 inches and you feel really light.
Good, okay. Suddenly growing 2 inches and feeling very light. You feel how that just pulled all apart. Yeah, and what that's doing, that's just removing pressure off the nerves, allowing the body to function and to heal as it's intended. So I know when you first came in, you were having some issues in the lower, like in that, the hips, the sacrum area, and then I know you were saying that you had some issues with headaches weekly in the neck. Obviously, it's not like you came in with a headache, so kind of hard. That one we're going to just follow up on. Just kind of shoot me a text and let me know how things are going.
Okay.
But I want you to look up, look down. How do you feel?
A little sore, but better.
Yeah, that pull, just so everyone knows, that Y-strap, that pull, that initial pull, it is...
It releases a lot.
Yeah, it releases quite a bit. So yeah, a lot of the times, like what I tell patients after, make sure and drink a lot of water. Please no heavy lifting today. I know you're on vacation, so yeah, no heavy lifting, just relax. But definitely let me know.
Okay.
How's the range of motion feel when you go to each side?
Good.
And then if you stand up in the low back, if you bend forward, bend backwards, you bend back. How's that feeling?
Good.
Good?
Yeah.
Better than when you first came in?
Yeah.
Good. That is what I like to hear. Definitely follow up with me.
Okay.
I always like to just see how patients are doing.
Okay.
But yeah, you're
Yeah.
all set.
Awesome. Thank you so much.
You're welcome. So, a flight out from California, definitely the furthest trip in America, so thank you for that one. But yeah, if anyone is looking to schedule an appointment, please go right to the website, drjosephcipriano.com. From there, just send me a message, and typically I'll respond within 1 to 2 days. But I'd love to get you in.
Yeah, thank you so much.
You're welcome. Have a good one, everybody.